Hi, my name is Kwekwe. I'm a pharmacist. In this video, I'll be reviewing the medication Sitagliptin. I'll go over most of the important things that you need to know about this medication, what it is used for, how it works in your body, the proper way to take it, and potential side effects to watch out for, as well as important safety tips that I believe anybody taking Sitagliptin should be aware of. Now, before we proceed, I just want to mention that this video is purely for educational purposes. It is not personalized medical advice. Please do not stop, or make any changes to your medication regimen without first talking to your doctor. So let's start with the basics. What is Sitagliptin? Well, Sitagliptin is the generic name and it's marketed under various brand names such as Januvia or Zituvio. You might also see it combined with other diabetes medications. So for example, Janumet contains Sitagliptin and metformin. Now, Sitagliptin belongs to a group of medications called DPP-4 inhibitors, which stands for dipeptidyl peptidase 4 inhibitors. That's a mouthful, so we typically just refer to them as DPP-4 inhibitors. Sitagliptin is specifically approved for treating type 2 diabetes in adults. It is not used for type 1 diabetes. Now, it is designed to work with your body's natural insulin production, which is why it's only effective in people who still make some insulin. Now, let's talk about how Sitagliptin actually works in your body. Now, to understand how Sitagliptin works, we need to talk about some natural hormones in your body called incretins. The main ones are GLP-1 and GIP. Now, if that sounds familiar, it's because the synthetic versions of these hormones are the active ingredients in medications like Ozempic and Mounjaro, which have become very popular in the last couple of years. Now, they do work differently from these medications though. These hormones are released from your intestines when you eat, and they have several important jobs in controlling blood sugar. So when you eat, your blood sugar starts to rise. These hormones tell your pancreas to release more insulin, but only when blood sugar is elevated. They also tell your liver to stop making extra glucose when you don't need it. Now, here's where Sitagliptin comes in. Your body has an enzyme called DPP-4 that breaks down these helpful incretin hormones pretty quickly, usually within minutes. Sitagliptin works by blocking this DPP-4 enzyme. So this allows the incretin hormones, for want of a better way, to stick around longer and do their job better. Now, what makes Sitagliptin special is that it only helps lower blood sugar when your blood sugar is actually high. When your blood sugar is normal or low, Sitagliptin doesn't push it lower, which means that it has a very low risk of causing hypoglycemia or dangerously low blood sugar levels when it is used just by itself. Now let's talk about how to take Sitagliptin correctly. So it comes as oral tablets in different strengths, 25, 50, and 100 milligrams. The most common dose is 100 milligrams once daily, but obviously your doctor may prescribe a lower dose if you have kidney problems or other issues. Now, it is typically taken once a day, and it doesn't matter if you take it with food or without food. It can be taken in the morning or evening or at any time that works best for your schedule. The only thing is that just try to take it around the same time each day just to help you remember and to keep consistent levels in your blood. Now, let's talk about some important safety information that you need to know about Sitagliptin. First, if you have kidney problems, this is crucial information for your doctor. Sitagliptin is eliminated from your body through your kidneys. So people with kidney disease typically need a lower dose. Your doctor may want to check your kidney function with blood tests before starting Sitagliptin and periodically while you're taking it. Also, if you have a history of pancreatitis, that's inflammation of the pancreas, make sure your doctor knows this. There have been some reports of pancreatitis in people taking medications in this class, though I must say that this is quite rare. Sitagliptin also generally does not interact with many other medications, which is one of its advantages. However, it's always best practice to tell your doctor and or pharmacist about all medications, supplements, and herbal products that you're taking so they can run a comprehensive drug interaction check for you. Now, while Sitagliptin itself rarely causes low blood sugar, when combined with other diabetes medications, the risk can increase. So make sure you know the signs of low blood sugar and always carry a source of fast-acting glucose with you just in case. Now let's talk about some potential common side effects. The good news is that Sitagliptin is generally very well tolerated by most people. The most common side effects are quite mild. Some people may experience upper respiratory tract infections, things like stuffy nose, sore throat, or cold-like symptoms. Some people might also experience headaches or have some stomach upset. There has also been reports of joint pain or muscle aches, though these are usually mild and don't require stopping the medication. Nausea can occur, especially when you first start taking sitagliptin, but this usually improves as your body adjusts to the medication. Now, here are some tips to help minimize some of the discomfort. If you experience stomach upset, try taking the medication with food, even though it is not required. Also, stay well hydrated, especially if you have cold-like symptoms. For headaches, make sure you're getting enough sleep and staying hydrated. Over-the-counter pain relievers are usually fine to use, but like I always say, check with your pharmacist if you have any additional questions. Now, let's talk about some potential serious side effects. Now, while serious side effects are rare with sitagliptin, it's important to know what to watch out for, just in case. So contact your doctor immediately if you experience any of the following severe side effects that I'm going to list. So for example, if you experience severe stomach pain that doesn't go away, especially if it is accompanied by nausea and vomiting, this could be a sign of pancreatitis, which is rare but serious enough for you to seek medical attention. There have also been rare reports of joint pain that can be severe and disabling. If you develop severe joint pain that interferes with your daily activities, contact your healthcare provider right away. Now, while also very rare, there have been reports of severe kidney problems in people taking sitagliptin. So needless to say, contact your doctor if you experience any swelling in your legs or feet, changes in urination, or unusual fatigue. Remember, these serious side effects are uncommon, but it's important to be aware of them so that you can seek medical help if needed. Now, don't forget that sitagliptin, like any other diabetes medication, works best when it is part of a healthy lifestyle. So continue following your dietary recommendations, stay active as approved by your doctor, and take your medication consistently. I sincerely hope you found some value in this video. If you did, please give it a thumbs up, stay blessed, and I'll catch you on the next video. Thank you.